services for the most vulnerable groups and weaknesses in health systems. The PSC commended the inclusion of timeliness, SDG 11 interventions, IHR core capacities, and engagement of communities and religious leaders. Subsequent to fruitful technical deliberations, members of the PSC recommended that the amended document be presented for consideration during the 68th session of the RC. 3. The PSC discussed the document entitled Framework for Certification of Polio Eradication in the African Region. The PSC stressed the need for sustained and activated polio vaccine IPV prioritization, mobilization of domestic resources for surveillance, immunization and human resource capacity strengthening, as well as the use of polio infrastructure to support routine immunization. Consequent upon pertinent technical deliberations, members of the PSC recommended that the amended document be tabled for consideration by the 68th session of the Regional Committee. 4. The PSC discussed the document entitled Status of Implementation of the 4 time-bound commitments on non-communicable diseases in the African region. The PSC extolled the Secretariat for progress made and acknowledged the challenges of the advancing of the NCD response. Members of the PSC stressed the need for high-level advocacy and representation at the level of heads of state at the UN summit using existing epidemiological data on NCDs in the region. Following comprehensive, relevant discussions, members of the PSC recommended that the revised document be tabled for consideration by the 68th session of the Regional Committee. 5. The PSC discussed the technical paper entitled Ensuring Sustainable Financing for Health in Africa in the midst of changing global and local economic factors. The PSC praised the Secretariat for the document and the initial actions undertaken to build the capacity of member states. The PSC members highlighted the importance of engaging a broader range of stakeholders beyond finance ministers, such as parliamentarians, to advocate for health. The PSC further recommended that the document be reviewed to reflect universal health coverage and highlight the value of healthy nations. Following exhaustive deliberations, members of the PSC recommended that the amended document be presented for consideration by the 68th session of the Regional Committee. 6. The PSC discussed the document entitled Report on Regional Managerial Compliance Activities and Matters Arising out of Internal and External Audits. The PSC commended the Secretariat for the well-articulated and comprehensive report, which summarizes the progress made on managerial and compliance activities and noted the clear linkage with the transformation agenda. The PSC recommended a further review of the document to state actions for member states, including resource mobilization for implementation and compliance with direct financial cooperation reporting requirements. Subsequent to intensive discussions, members of the PSC recommended that the amended document be submitted for consideration by the 68th session of the Regional Committee. 7. The PSC discussed the document entitled WHO's Work on Resource Mobilization through Strengthening Partnerships to Better Support Member States. The members of the PSC commended the Secretariat for a well-articulated document while recognizing the challenges inherent to resource mobilization. The PSC further recommended that the Secretariat should expand funding sources by exploring innovative approaches. Following in-depth deliberations, members of the PSC recommended that the amended document be presented for consideration by the 68th session of the Regional Committee. 8. The PSC reviewed the document entitled Proposal for a Code of Conduct for Nomination of the Regional Director. The PSC applauded the Secretariat for the document and observed that the amendments to the rules of procedure and the draft resolution were acceptable. The PSC further recommended that the document be reviewed to reflect precision on decisions of transparency, accountability, conflict of interest, and code of conduct. Following comprehensive, pertinent deliberations, members of the PSC recommended that the amended document be presented for consideration by the 68th session of the Regional Committee. Part 3. Discussions on other items proposed by members of the PSC. In line with the revised terms of reference of the PSC, members took the opportunity to raise other issues for discussion. These included inadequate funding for NCDs and the need for more support from the Secretariat in this regard, an update on the response to the Ebola outbreak in the Democratic Republic of the Congo, progress on the elimination of malaria, and the need for member states to be adequately prepared for the high-level meeting in the General Assembly in September 2018 on ending tuberculosis. The PSC reviewed the agenda of the 68th session of the Regional Committee and recommended its readjustment to reflect the linkages between progress report on the implementation of the transformation agenda of the World Health Organization Secretariat in the African region 2015 to 2020, the report on regional managerial compliance activities and matters arising out of internal and external audits, and the report on the WHO's work on resource mobilization through strengthening partnerships to better support member states. The PSC considered proposals for the designation of member states on councils and committees that require representation from the African region. The outgoing PSC members thanked the PSC and the Secretariat for their support and engagement throughout their terms. The PSC recommended the following proposals for the endorsement of the 68th Regional Committee. A. Membership of the Program Subcommittee. The terms of office of Kenya, Liberia, Namibia, Seychelles, Sierra Leone, and Uganda come to an end at the 68th Regional Committee for Africa. The following member states are proposed to be on the PSC. Sub-Region 1, Mauritania, Nigeria, Senegal, Togo, Cabo Verde, Cote d'Ivoire. Sub-Region 2, Ethiopia, Sao Tome and Principe, Rwanda, Cameroon, Chad, and Equatorial Guinea. Sub-Region 3, South Africa, Botswana, Zimbabwe, Angola, Comoros, and Lesotho. B. Membership of the Executive Board. The terms of office of Algeria and Burundi on the Executive Board will end with the closing of the 72nd World Health Assembly. In accordance with Resolution AFR RC 54R11, which decided the arrangements to be followed in putting forward the member states of the African region for election by the World Health Assembly, it is proposed as follows. 1. Burkina Faso and Kenya will replace Algeria and Burundi in serving on the Executive Board, starting with the 145th session in May 2019, immediately after the 62nd World Health Assembly. Burkina Faso and Kenya will thus join Benin, Eswatini, Gabon, United Republic of Tanzania, and Zambia on the Executive Board as indicated in the table below. 2. This table is found on page 6. I will not go through that, please, for time's sake. 2. Benin to serve as Vice Chair of the Executive Board as from the 145th session of the Executive Board. C. Mode of work and duration of the 72nd World Health Assembly. It is proposed that the chairperson of the 68th session of the Regional Committee for Africa be designated as Vice President of the 72nd World Health Assembly to be held from 20th to 28th May 2019. With regard to the main committees of the World Health Assembly, and based on the English alphabetical order and sub-regional geographical grouping, it is proposed as follows. Angola to serve as the chair for Committee A. Niger, Nigeria, Congo, Democratic Republic of the Congo, and South Africa to serve on the General Committee, and Liberia, Eritrea, and Seychelles to serve on the Committee of Credentials. D. Officers of the 68th session of the Regional Committee, Chairperson, Senegal, Vice Chairpersons, Namibia, and Sao Tome and Principe. Rapporteurs, Algeria, French, Mozambique, Portuguese, and Uganda, English. E. Regional Committee, Committee on Credentials. The following 7 countries are proposed to serve on the Committee of Credentials: Comoros, Eritrea, Guinea-Bissau, Liberia, Mauritania, Mauritius, and Rwanda. Mr. Chairman, distinguished ladies and gentlemen, finally, adoption. The PSC members were presented with a draft report of the proceedings of the PSC meeting held from the 12th to 14th June 2018. The members reviewed the report and unanimously adopted the recommendations subject to minor amendments. The meeting was closed with a vote of thanks to all participants, including the PSC members and the Secretariat. I thank you all for your attention.
Merci, Docteur.
Thank you, Dr. Thomas Samba. We'd also like to thank the program subcommittee for its diligence in conducting the preparatory work on behalf of the regional committee. Are there any observations or any comments on this report? None that I can see. So I take it that the committee is ready to take note of the report of the PSC. The report is noted. Distinguished delegates, we will now consider proposals for the designation of member states on councils and committees that require representation from the Africa region, as recommended by the program subcommittee in the statement of the chairperson of the subcommittee. We will start with the membership of the program subcommittee. The terms of office of Kenya, Liberia, Namibia, Seychelles, Sierra Leone and Uganda come to an end at the 68th Regional Committee for Africa. It is therefore proposed that they should be replaced by the following countries: Cabo Verde, Comoros, Côte d'Ivoire, Equatorial Guinea, Lesotho, Chad. The full membership of the PSC will therefore be as follows. For Sub-Region 1, Mauritania, Nigeria, Senegal, Togo, Cabo Verde, Côte d'Ivoire. Sub-Region 2, Ethiopia, Sao Tome and Principe, Rwanda, Cameroon, Chad, Equatorial Guinea. Sub-Region 3, South Africa, Botswana, Zimbabwe, Angola, Comoros, Lesotho. Now, are there any comments on this draft decision? If there are no comments, I would like to propose that we adopt the decision as proposed. Thank you. The decision is hereby adopted. Let us now look at the Executive Board. The terms of office of Algeria and Burundi on the Executive Board will end with the closing of the 72nd World Health Assembly in May 2019. In accordance with Resolution AFR RC 54/R11, which decided the arrangements to be followed in putting forward the member states of the Africa region for election by the World Health Assembly, it is proposed as follows. Burkina Faso and Kenya to replace Algeria and Burundi in serving on the Executive Board, starting with the 145th session in May 2019, immediately after the 72nd World Health Assembly. Burkina Faso and Kenya will thus join Benin, Eswatini, Gabon, United Republic of Tanzania, and Zambia on the Executive Board. It is further proposed that Benin should serve as Vice Chair of the Executive Board as from the 145th session of the Executive Board. Now, are there any comments on this draft decision? None that I can see. So I would like to propose that we adopt the decision as proposed. Thank you. Decision is hereby adopted. Now, regarding the method of work and duration of the 72nd World Health Assembly, it is proposed that the chairperson of the 68th session of the Regional Committee for Africa be designated as Vice President of the 72nd World Health Assembly to be held from 20 to 28 May 2019. With regard to the main committees of the World Health Assembly and based on the English alphabetical order and sub-regional geographic grouping, it is proposed as follows. Angola to serve as the chair for Committee A, Niger, Nigeria, Congo, Democratic Republic of the Congo and South Africa to serve as the General Committee, and Liberia, Eritrea and Seychelles to serve on the Committee on Credentials. Are there any comments on this draft decision? If there are no comments, I would like to propose that we adopt the decision as proposed. Thank you. The decision is adopted. I am informed that the PSC did not consider the nomination of representatives to serve on the special program of research development and research training in human reproduction, membership category 2 of the Policy and Coordination Committee, PCC, and we have to elect 2 members. The term of Mauritius will end on 31 December 2018. In addition, the membership of Madagascar ended on 31 December 2016, but was not replaced at that time in the PCC. In accordance with the English alphabetical order, it is proposed that Mauritius and Madagascar be replaced by Niger and Nigeria for a period of 3 years, with effect from 1 January 2019 to 31 December 2021. Niger and Nigeria will thus join Namibia and Mozambique on the PCC. Are there any comments on this draft decision? If there are no comments, I would like to propose that we adopt the decision as proposed. Thank you. The decision is adopted. Thank you, colleagues. This brings us to a close on this agenda item, and we can continue by looking at agenda item 7, entitled Progress Report on the Implementation of the Transformative Agenda of the World Health Organization Secretariat in the Africa region. Please open the document AFR 68-4. I will now give the floor to Acting Director, Office of the Regional Director, Dr. Francis Kasolo, to present this document.
Honorable Ministers, distinguished ladies and gentlemen, on behalf of the Secretariat, I have the privilege to introduce document AFR/RC68/4, entitled Progress Report on the Implementation of the Transformation Agenda of the World Health Organization Secretariat in the African region 2015 to 2020. The purpose of this document is to update the Regional Committee on the progress made in the implementation of the transformation agenda in the African region, in line with the outcome of the Regional Committee 65. This document is a third such report and covers the last 3 years of the transformation agenda implementation. The endorsement of the transformation agenda by the Regional Committee 65. Since the endorsement of the transformation agenda by Regional Committee 65, WHO in the African region has embarked on a transformational journey that sought to accelerate the implementation of change within the region and to ensure the emergence of WHO that the staff and the stakeholders want. Significant progress has been made in the implementation of the transformation agenda, as highlighted yesterday by Dr. Maweti at the opening ceremony, as well as in her report to the Regional Committee. For example, the organization is now responding better and in a timely manner to health emergencies. Afro is now a more accountable region as a result of internal control systems introduced to enhance budget center performance and oversight. The human resource deployment at the region and inter-country levels are now better aligned with the member states' health priorities in our region. With respect to accountability for results, programmatic and managerial key performance indicators have been introduced as part of the results framework to help in the monitoring performance of budget centers and measure contribution towards health development in the member states. The region has also made progress in strengthening its financial resource base by engaging with traditional as well as new donors, and also by improving the tracking and reporting of donor technical and financial reports. There has been an increase in donor commitments and support in the different health priority areas. The progress made has been validated by an independent evaluation of the transformation agenda that was undertaken in April 2017 by the WHO Evaluation Office in Geneva at the request of the Regional Director. Despite the steady progress so far in implementing the various activities under the transformation agenda, a few challenges remain. For example, we still have to work on strengthening effective communication. Prioritization of our work at country level remains a major challenge due to the broad diversity of countries in our region and the need for WHO to expand its staff profile to match the country needs. Going forward, the Secretariat is proposing the following next steps: to institutionalize the transformation agenda by promoting change in the organization culture defined by the values of excellence, teamwork, accountability, integrity, equity, innovation, and openness. To integrate the key performance indicators into existing WHO processes, systems, and structures of budget centers in order to clearly measure our performance as a region. To improve WHO capacity at country level, and in this regard, we will continue with the evidence-based functional review exercise in the remaining countries, as well as refine the review process through lessons and experiences encountered so far. We are also actively aligning with the General Program of Work 13 and the Global Transformation Program being undertaken at the global level. And finally, we want to ensure more involvement of member states in monitoring and implementation of the transformation agenda, especially as it relates to the country level activities. The Regional Committee is requested to take note of this report and the proposed next steps. Thank you, Mr. Chairman.
Je vous remercie.
Thank you very much, Dr. Francis Casulo. Ladies and gentlemen, delegates, if you have any comments or observations. I think Ghana has asked for the floor. Ghana, you have the floor.
Ghana welcomes the transformation agenda of the WHO Africa region as an ambitious agenda that will catapult the effectiveness of the African Regional Office. We recognize that this is a key vision of the WHO Regional Director, Dr. Matshidiso Moeti, which began in 2015, and we stand ready to support it as a country. We associate ourselves with the 4 work areas of the agenda, namely fostering pro-resource values, smart technical focus, responsive strategic operations, and effective communication and partnerships. Honorable Chair, in the area of fostering pro-resource values, Ghana particularly believes that the emphasis on creating a new organizational culture is paramount. We welcome the development of a change management strategy and the continuous monitoring and evaluation whose processes have been well highlighted in the document. We need to build a culture of imagination, innovation, honor, and creativity. Ghana believes a culture of honor should be created and respected. My delegation applauds the creation of the regional change networks. Most importantly, studies on behavior change show that leaders who walk the talk can bring meaning to the description of the desired new culture, making it real for others in the organization. With regards to the smart technical focus, Ghana very much welcomes the creation of the WHO Health Emergencies Program and the framework for health systems development towards universal health coverage in the context of the Sustainable Development Goals in the African region adopted at the 67th session of the Regional Committee meeting in August 2017 in Zimbabwe. Honorable Chairman, Ghana welcomes the preparation of the regional country-specific analysis of the state of health services and health systems in the region. We believe that we should go beyond this document and start looking at the ranking of health systems in the region. As regards responsive strategic operations, my delegation notices that between August 2015 and September 2017, overall control effectiveness within the WHO Regional Office for Africa, as evaluated by the Office of Internal Oversight Services, surged from 50% to 77%. This progress has moved us from the bottom position to the 3rd in the 5 WHO regions. However, we still need to further strengthen the internal audit function in the organization to make it fit for purpose. In terms of communication and partnerships, we particularly welcome the improvement in our engagements with the media, as well as our strategic partnerships with the Center for Disease Control and Prevention in Africa, the Africa Health Forum, and the Harmonization in Health in Africa, amongst others. If well developed and implemented, these 4 key areas will enable all 47 member states on the continent achieve universal health coverage. Honorable Chairman, as we begin the next phase of the transformation agenda, Ghana believes we need to go beyond delivering for results to mapping out all the delivery chains in the organization and identifying the weakest links for strengthening. Appropriate actions should be taken against individuals who constitute these weakest links. My delegation concludes by congratulating the Regional Director for the WHO Africa region for embarking on such a transformative agenda. I thank you.
Thank you very much. We'd like to give the floor to Tanzania.
Thank you to give me this opportunity. Chairperson, Tanzania takes notes on the 3 years progress report on the implementation of the transformation agenda, on which we commend the Secretariat for daily detailed reports and the good work done during this period. We note with appreciation progress made toward improving value with the establishment of the network of staff who have volunteered to be change agents. Also, efforts made in pursuing smart technician focus in line with priority of our region. Also, the inclusion of strengthened health system for universal health coverage and sustainable development goal is another flagship initiative for the region. We further commend the Secretariat for excellent job done in improving financial management in the regional office, especially in the areas compliance and quality insurance, where our region has moved from last position to the third position based on the results of the Office of Internal Oversight Service. We hope by 2020 our region will have sustained with gain and achieve the desired results. We also note with appreciation that for the past 2 years, the region has not had an unsatisfactory audit reports. Chairperson, the report indicates an ongoing re-alignment of human resources in line with the country-focused approach, where 26 country offices in region have been reviewed through the functional review exercise, while recommendations for only 6 countries have been approved. We will appreciate to get more information on this process, including the list of those countries that have been reviewed and more insight on why were in low recommendations approval of by country, taking into consideration the task of realigning resource is an ongoing issue, and more countries will be undergo the review. Furthermore, we have noted one of the challenges presented in prioritization due to the broad diversity of countries' need. We wish to continue presenting our view on this as commented on the same issue in the last year, that we don't review this as challenge but a reality that country needs are different, and we don't expect the WHO or other stakeholders to try to harmonize our needs. The diversity should not continue to be seen as a challenge. Instead, we encourage WHO to develop mechanisms of addressing each country's need basis on WHO mandate and core capacity, and foster partnership with other organizations to meet the diverse needs and requests from countries. We continue to suggest that the needs to continue having differentiated approach in supporting countries in the Africa region, instead of assuming that health needs and support can be generalized to all countries in the same way as we have different health systems. Chairperson. Lastly, we support the proposed next step, including process to ensure active participation of member states in the transformation agenda. I thank you for listening, and I wish you all the best. Thank you.
Je vous remercie.
Thank you very much. We'd like to give the floor to Kenya.
Thank you, Mr. Chairman. Now, Kenya takes note of the progress report on the implementation of the transformation agenda of the WHO Secretariat in the African region, and thanks the Secretariat for preparing this comprehensive report. And also we take this opportunity to once again congratulate the Regional Director for our exemplary vision and leadership in the implementation of this agenda that has seen the Secretariat more responsive to the needs of the Member States and also increased transparency and efficiency in the operations of the Secretariat, both at the regional level and also at the country level. And following the adoption of the framework for health systems development towards universal health coverage in the context of the SDGs in the African region by the last regional committee, we are pleased to report that Kenya has embarked on its implementation. And the push was given further impetus when in November last year, His Excellency, the President of the Republic of Kenya, declared the achievement of universal health coverage by the year 2022 as part of his Big Four agenda for his last term in office. And since then, we have received tremendous support from the regional office in crafting the roadmap for the universal health coverage, which we are now implementing, and this has also been backed up by a sustainable benefit package that we just completed. We wish to thank the regional office for their constant engagement and support in secondment of technical expertise to the Kenya WHO country office so as to boost the technical capacities that are required in this endeavor. And we continue to urge the Secretariat to expeditiously complete the functional review and provide feedback to the remaining countries so that member states are assured of the necessary support as they strive to achieve their global and local commitments and targets. In conclusion, Mr. Chairman, Kenya takes note of the Regional Director's report and reaffirms its support to the implementation of the transformation agenda. I thank you.
Je vous remercie.
Thank you very much. I would like to give the floor to Ethiopia.
Thank you, Chair. Ethiopia would like to congratulate the Secretariat for comprehensive report on implementation of the transformation agenda of WHO in Africa region 2015 to 2020. Ethiopia also commends the Regional Director, Dr. Moeti, for her commitment and close follow-up on the implementation of transformation agenda. In April 2017, an independent evaluation was made on the progress of transformation agenda, and the results were published and circulated to the member states on 66 RSM. And we have applauded the Secretariat for their excellent job, and we also expressed our position that the finding and recommendation of the evaluation should be well considered during its implementation. It's also important to indicate that there is a wide room and effective partnership with stakeholders like African CDC. And we really appreciate, as a board chair of Africa CDC, we really appreciate Dr. Moeti for her visit to Africa Union and Africa CDC, and we have a very good discussion in to strengthening our collaboration. Our countries believe that it's important to indicate that the report for the future should be able to demonstrate the following 2 points. The first one is to present the ways that can provide information on the marginal value of the change score due to the implementation compared with the baseline. And second, alignments of result to the global WHO reform and transformation process. And again, the government of Ethiopia reiterates unwavering support to the regional directors on the transformation process, and will continue closely follow up the status of the implementation for the future. I thank you.
Thank you very much. Nigeria, you have the floor.
Thank you so much, the Chair. I want to use this opportunity to thank the Secretariat for a well-prepared report and to appreciate the Regional Director for focused leadership that has generated tremendous improvement within the African health sector. We want to thank the Secretariat and identify with the report that has been prepared. This is the third in the series since she commenced the wonderful transformation agenda for the sub-region. We also wish to identify with the 4 focus areas: pro-result values, smart technical focus, responsive strategic operations, as well as partnership and communications. We want to especially thank the Regional Director for her support to Nigeria. She's visited Nigeria on quite a number of occasions. We have benefited tremendously in supporting public health emergency response in Nigeria, directly and indirectly. She also facilitated a joint external evaluation in Nigeria, and we accepted in good faith the result of the joint external evaluation, and we've commenced initiatives to address the gaps identified by the JE. We also want to thank the Regional Director for facilitating a scoping mission to assist Nigeria in the attainment of universal coverage. The scoping mission came and visited us, identified with our desire to implement a robust UAC agenda for Nigeria through implementing a robust transformation program at the primary care level. We also benefited tremendously from a polio eradication program. And when we actually had 2 years of break, and then in 2016 we had this outbreak, and I must commend her. She had a telephone conversation with us and supported us. And so far we've recorded another 24 months without a single case being detected. WHO has been a strong partner in the operations in the Lake Chad region, and we want to thank her for this. We've also enjoyed better coordination with the country office. We worked together to look at the 3-year program, and this to me has been very helpful. When we decided to adopt the report of the mix survey, which puts the immunization coverage in Nigeria at 33%, we declared a state of emergency and launched a national emergency on routine immunization. And WHO has been very supportive of this effort, and we're looking at accountability, leadership, and also better use of data, and also trying to engage community and through a focused leadership. And this has helped us to move things up. We also, for the first time, benefited. The DG brought the executive board meeting to Nigeria. And so through the regional director, we want to thank the DG of WHO for holding his executive board, the first one in Africa, in Nigeria. And we used the opportunity of that meeting to also launch the eye strategy for containment of yellow fever in Africa. As you might be aware, we have launched a massive immunization program against yellow fever in Nigeria. On that occasion, the DG also launched the Basic Care Provision Fund and a unique instrument. We call it Uwe in Nigeria. Uwe is a local language for life. So the DG launched the Uwe project that will enable us to provide basic care to over 100 million Nigerians. And so we want to thank you for this, and we also want to thank you for supporting the Gavi transition program in Nigeria that will enable Nigerians to transition over a 10-year period before we assume full responsibility. Mr. Chairman, I think while noting the tremendous report that has been made, we now have to look at the next phase of the transformation agenda with respect to implementation. I think we need to build on the successes that we have recorded so far. We have to look at how do we mobilize resources, particularly within the African sub-region, and really cut down on our dependence on external donor support, and also move beyond asking for political commitment. I think commitment alone will not take us far in Africa. We also need political action, and we should find a way to network with the African Union and involve our leaders, our heads of state, in taking leadership of health. Health should be seen as a development issue and not just as expenditure. And it is important that very soon countries will be rated by their investment in our people, true commitment to health and education. Thank you.
Je vous remercie.
Thank you very much. We'd like to give the floor to Congo. Thank you very much, Mr. Chair. The Congo welcomes the agenda for transformation in our region and congratulates the regional director for her regular updates. However, we do have certain remarks to make considering the quality of the document which has been submitted, and we would have wished, first of all, that the editing or the writing of the document in fact be harmonized so that the contents, for example, in terms of the progress made, be much more clear. Otherwise, it has been well documented, for example, but we've got certain issues that are very vague. For example, in terms of the production of results, or but where progress accomplished, it should be able to be accompanied by a collective support to change. In terms of the strategy and efficient communication, in terms of the findings of the partners, those progress made also would merit more explanation, particularly in terms of the funding, additional funding, which has been strengthened particularly with the new donors. How many funders are we talking about, and also in terms of the amounts given, how much exactly are we talking about, and also in terms of the next budgets, what is going to be done. It is the same for the improvement also of the financial contribution of the regional institutions. Certain agreements and collaboration have been made. It hasn't been indicated with whom and which area and how the coordination of all these contributions are going to be made, so that we have information on priority areas. Finally, in terms of the fund, the functional reviews have been made in terms of certain country bureaus, and the Congo, in fact, is one of those. But the consequences, in fact, have not yet been perceived. It would be desirable to accelerate the process since we are coming to the fourth year of the implementation of the transformation agenda. In terms of the countries themselves, it is expected, more support and visibility is expected from this transformation agenda. In the Congo, the expectations of the government and of the Congolese themselves are numerous, and they do believe that these will be taken into account in the agenda, in the process of transformation. Although, and you will understand with us, that there is some impatience since Brazzaville, for example, has the headquarters of the Regional Bureau for Africa. So our country in itself could legitimately expect to be the first country to be positively affected by this transformation agenda. Finally, the Congo, as we've said right from the beginning, and and as been expressed by the Prime Minister and by the head of state of Congo during the visit of the regional director and the general director of the WHO, Congo supports the Agenda Transformation Program. And we would like once more to thank the regional director for her official visit to the Congo, and also we were honored by having the Director General visit us. We do follow very closely all the commitments that have been made towards the Congo, but not just Congo, but Africa, during those exchanges. Thank you very much. Thank you, and we'd like to give the floor to Zimbabwe.
Thank you, Mr. Chairman. Zimbabwe welcomes this report on the transformation agenda and its implementation. And we also recognize that it has become very popular within WHO, and credit should be given to AFRO for this initiative. But more importantly now, we know that this transformative agenda is based on a culture change in the organization, where the people are more responsive, the Secretariat is more responsive, the staff is more responsive, and it is purely now country-focused. And I think that we should applaud. But as we look at this transformative agenda, I also urge the Secretariat to emphasize the role of WHO as a lead agency of health, technically in our countries. I think we need to emphasize that. We do not want WHO to be overshadowed by other organizations within our own countries in terms of technical know-how and technical support in our countries. But we also recognize that one of the biggest challenges that it has is in terms of funding. So we would like, as you look at this transformative agenda, to also just interrogate the issue of funding. You probably we are going to be overshadowed because funding goes elsewhere. We are not generating our own donorship in terms of funding. And you find, with all due respect, other organizations like UNICEF taking a more prominent role because they seem to get this funding a bit more. So we urge you, as you do your transformation, and just to look at the issue of funding and make sure that WHO in its own right has got a base for funding. Otherwise, the transformative agenda has been extremely helpful to Zimbabwe in terms of HIV when we started our self-testing, and they facilitated a lot of that. And when we had the recent outbreak of typhoid in one of our cities, WHO was very much in the forefront in terms of coordinating. So I'd like to thank WHO, and as Zimbabwe, we take note of this report and we really support this transformative agenda. I thank you, Chair.
Thank you very much. We'd like to give the floor to Burkina Faso. Thank you very much, Mr. Chair. Burkina Faso also welcomes the technical depth and the relevance of this report, which was presented to us on this transformation agenda proposed by the WHO. Personally speaking, it is a program which has inspired me. And when I actually became minister, it is a program which has been guiding me towards my own actions. However, I have certain comments, some very general comments I'd like to make, which translate my ambition for the Regional Bureau of the WHO. The first comment I'd like to make is relative to what we call, which is the presentation of the findings and also to get an impact. The reflection on the impact trajectory of the program is not perhaps illustrated well enough in the report, and what might be more illustrative would be that this transformation agenda take as a trajectory that of presenting health-related results so that there be an impact on the health of Africans, and also that the report every time, in fact, show the progress on what is the progress made relative to the health of Africans, the satisfaction which we have with our own health systems recommended by the WHO, and also the progress made in terms of equity. When we talk about impact, I would be happy if we perhaps could see this more clearly, and that it be ahead of many of things that we do, and what is the impact, in fact, on the status of health of our African region. We do not really have an illustration of where we really are in terms of our status of health, and this transformation agenda should be able to lead us to this result. The second comment that I would like to make is related to an in-depth discussion I heard from Zimbabwe in terms of a stronger leadership, of a greater leadership that we would like the WHO to present. In our different countries, and particularly in Burkina Faso, the WHO, in terms of leadership in health, seems to be, in a way, just be part of all the different technical support we have. And we have now noted that all the good intentions in terms of the Paris Declaration on one plan, one budget, one report, there is no real authority in terms of the financial impact of the partners. We should be able to align all our technical partners within this agenda, and today each partner, in fact, raises his or her flag, whereas if the WHO would give itself the mandate to align everybody in terms of this agenda, so that the development of our health system be truly led by a single plan, a single budget, a single report, I think that we would actually advance far quicker instead of the cacophony that we keep on using, because we do not hear as the strong voice of the WHO, who in fact should be leading all these partners, and also the transformation agenda, and it should focus this much stronger leadership in terms of health. I would also like to take the example, an example which might help us, and that is the general mandate of the universal health coverage, which since 2005 has been the credo, the manifesto. If we look at how this is working in different countries, this mandate has been entrusted, for example, to the Department of Social Development, in other countries to the Ministry of Public Function, to another is the Minister of Finance, and in other countries to the Ministry of Health. And often the Ministry of Medicine, in fact, and not health. So a leadership which would be stronger would in fact present a model, a single model, to say this is the way we should in fact be able to achieve this universal health coverage, and would in fact guide countries in how to create a model which would function, because in the hands of people who do not understand what it's about, this universal health coverage for me is going in too many directions, and too many different directions. This leadership itself also could take as an example what I see, for example, in terms of the UNICEF, where immunization, there is a true procurement area, so that in fact vaccines arrive in countries. For the UNFP, for example, there is a procurement unit as well in terms of family planning. For the WHO, we, for example, speak of hepatitis, and Algeria finds that it has medication accessible But I see that, for example, in our area, we would like to have a procurement area because it is, for example, in some illnesses like hepatitis C, for example, we could eliminate it very quickly if we had access to the right products, affordable, and where, for example, all the testing and diagnostics could all be done together for those who are infected. Since each country is always fighting alone, we will not be able to make strides quick enough. So if I do take a parallel with family planning for medication, perhaps the WHO could also think in its transformation agenda how you could also have a procurement unit so that group procurement, in fact, it could also go far quicker and we could eliminate certain illnesses.
Pour terminer.
Now, to conclude, I'd like to come back a bit to what I heard yesterday when we were talking about the 2020-2021 budget, where in prioritization I noticed that a number of things seem to hide the service delivery. When I looked at the health profile and countries' difficulties that they need to overcome, big problems are really in governance of the health sector, especially also financing of the health sector. Today, we know the kind of appropriate level that we need to deliver services properly. We need to mobilize resources. We need to develop also efficiency in terms of allocation. Unfortunately, countries are not ready to take up such challenges. If we need, for example, $86 per inhabitant per annum, and the countries can only mobilize $20, $30, you can see immediately that there will be very limited progress. And this is obvious. So these are the major challenges that we need to take up and which can show, if we succeed, that change is possible. This is just advocacy, therefore, for strong WHO leadership. WHO is the natural leader, I think, for our health partners and stakeholders in our countries. In Burkina Faso, this year is Switzerland, next year it's the USA, and then the World Bank, and there is no coherence in terms of the development of our systems in our countries. I think we need to really talk about strong impact and strong leadership by WHO to set very strong standards so that we can really achieve universal health coverage. And we should be able to also take up the challenges such as governance and financing. I'd like to once again commend the Director General for this very, very good report. Thank you. We'll give the floor to Sierra Leone now.
The Chairman, thank you so much for allowing our voice to be heard. Let me join others in thanking the Regional Director for taking the lead in developing the transformation agenda. There are a few issues I would like to comment on. In particular, is that Sierra Leone was exposed to the Ebola virus, and response time to health emergencies is very, very critical. May I therefore register our support that WHO is doing its best to improve its response time. Quite recently, we were exposed to a small issue on meningitis, and the response time of WHO in partnering with the ministry was tremendous indeed. And we would therefore like to highlight here that we feel that the country team is doing extremely well in supporting the Ministry of Health. It is with regards to that I think WHO should continue to partner with the country ministries of health. There are too many reviews, assessments done by independent agencies, and a lot of resources are spent on these reviews and assessments before any tangible work is done. If indeed the in-country WHO offices could really indicate what is the disease exposure or the statistics that exist, then we will not have agencies going out to get baseline surveys regularly. A third issue that I would like to highlight is the fact that the health systems in countries that have been exposed to debilitating factors quite recently may be quite weak. The health systems may be quite weak, and as such there are gaps with regards to tracking donor support. We feel quite pleased that WHO in this transformative agenda would like to improve its tracking techniques. Finally, with regards to human resource development, we do hope, as has been said, that we will focus on country requirements. We would like to say here that if these trainings, a lot more of these trainings become institutionalized, it will help cut down a lot of wastages that we do have. A lot of the trainings seem to be on short-term workshop type of trainings that tend to be quite repetitive, and a lot of resources tend to be utilized then. So we would like to recommend that indeed, as we strengthen the linkages within countries, that we try to institutionalize quite a few of these. Once again, may I congratulate the regional director. I thank you.
Give the floor to Uganda, reminding us that yesterday we adopted the budget, so please be limited in your address. Thank you. Uganda.
Thank you very much, Chair. Chair, Uganda also welcomes the third progress report of this transformation agenda and applauds the WHO Regional Director for her vision and also oversight in the implementation of this agenda. And we note that it includes the alignment to the strategic priorities of the Global Transformation Plan and architecture. The WHO Afro Secretariat now operates like a business entity that demonstrates returns on investment for the WHO Africa shareholders, who are we, the member states. Uganda welcomes the significant progress in the pro-results values. We also note the significant progress that has been made in the epidemics and emergencies capabilities of the WHO Afro region. Improvements in governance as reflected by the audit reports are particularly gratifying. We welcome the improvement in the female complement of the professional staff, and we want to applaud the regional director, regional office, and we note that this has improved from 24% to 29%, and we hope that it will progressively rise to at least 50%, aware that 52% of Africans are women. The global economic challenges which have resulted in diminishing financing for WHO mandates focus on increasing efficiency with which available resources are utilized. An agenda that focuses on results will attract more funding to WHO from member states and partners. Therefore, an explicit, concise results framework with clear baselines will be key in demonstrating returns on investments at the Secretariat. To enhance the South-to-South collaboration in dealing with public health challenges, we recommend that the Secretariat considers establishing a robust database of experts in the South that would facilitate the South-to-South support and experience sharing in public health. In common areas of interest, countries should consider and commit to specializing in particular aspects that would strengthen this South-South collaboration. Uganda therefore calls on the regional office to prioritize optimal staffing of the WHO country office in Uganda to enable more robust support in Uganda from that office. I want to thank you, Chair.
Je vous remercie. Nous donnons la parole.
Thank you. We'll give the floor to Comoros.
Merci, Monsieur le Président.
Thank you, Mr. Chairman. We would like to congratulate the Director for this excellent report on the transformation agenda for the Secretariat and WHO. And this is a very good lever for implementation of WHO reforms in West Africa and African region in general. This agenda's aim is to ensure WHO is in a better position to ensure universal health coverage and achieve our development goals. Comoros is very happy at the progress made in emergency preparation, the management of epidemics, eradication of polio, and the important programs of universal health coverage alignment of priorities granted to countries in the General Work Programme. And Comoros supports this report and would like to urge other states to adopt it. Thank you very much, Mr. Chairman. Thank you. We'll give the floor to Zambia.
Thank you very much, Chairperson. Zambia notes the third progress report on the transformational agenda of the World Health Organization. And from the word go, I'd like to state that Zambia reaffirms its support for the transformation agenda. Further, we want to place on record our admiration and appreciation for the hard work of the regional director and her team in pushing this transformational agenda. Chairperson, in Zambia, we are pursuing a transformational agenda that is informed by World Health Organization building blocks. Our focus is on building strong health systems to enable us to deliver universal health coverage using the primary health care approach. And in pursuit of this, Chairperson, we are working together with a local office and other partners in one strengthening health systems, following health in all policies, focusing on healthcare financing. We've introduced the compulsory national health insurance, and we are also focusing on health security. A country focus, I would urge, in various countries that WHO is working in, on public health diseases such as malaria, and we should focus on malaria elimination, HIV/AIDS epidemic control, and TB. Chairperson, I'd like to emphasize that WHO should be working very closely as secretariats for various ministries of health in various countries and should actually be able to focus on these issues that are particularly important for those specific countries. A particular focus on health security, I must emphasize. Health security is a must invest for all our countries, and I would urge WHO to work very closely with Africa CDC and member countries to support establishment of national public health institutes so that we can strengthen health security. Health in Zambia is considered as an economic investment, an imperative for investment, and this is to ensure that we could develop the human resource to drive our socio-economic development agenda. I would like to conclude, Chairperson, by thanking WHO for responding quickly for helping us respond quickly during the recent cholera outbreak, and for supporting us in moving the resolution to eradicate cholera by the year 2025. Chairperson, let's sustain the gains that we've built on, that we've seen in this progress report, and ensure that we build on them. I summarize health systems for UHC using primary health care approach should be a must. Health in all policies, health security, Collaboration between Africa CDC and WHO critical in fighting epidemics in Africa. And healthcare financing, supporting innovation in improving domestic financing for health systems is extremely important. And let's not lose our focus on public health in diseases such as malaria and HIV and TB. Chairperson, I thank you.
Thank you very much. I give the floor to Central African Republic. Thank you, Mr. Chairman. I would also like to congratulate the regional office for this report and this excellent initiative, which has a lot of potential, as previous speakers have said, and this potential should be fully exploited for fuller advantage. I think, we need an ambitious and Professor Kenum was very ambitious also, and was thought of creating the Faculty of Medicine, and the Faculty of Medicine was indeed established, and I'm one of the products of that ambitious initiative. And it's thanks to that we have doctors in our country, and we need to be equally ambitious in a transformative manner, a structuring manner by WHO. I'd also like to congratulate and thank the regional office, and through the office, the Director General of WHO, for the pragmatic manner and the focus on supported countries. My country has enjoyed a lot of support and received a visit by the regional director, and following which visit we took measures to address the most pressing needs. Nevertheless, I'd like to comment on three things. First one is human resources. Human resources. We are at a crossroads in my country, and we have a Faculty of Medicine that are trained doctors and nurses, and we realize we have a crisis of specialists. It's a small country. We don't know how to tackle this. We have put this question to the Director General, who has promised to help. And we'd like the regional director to spare a thought to that as well. And we have a crisis on our hands. We have 2-3 anesthetists in Bangui. A second point is on Ebola. We need to avoid the minimalist approach to Ebola. Wherever we have an outbreak, it becomes global. Really, it can affect everybody in the world. So we shouldn't just therefore say it's a regional thing and the world is not concerned. We can have a nasty surprise if we adopt that approach. So risk-based approach should be the way to go, and not the case-based approach. Therefore, sub-country support should be driven by the needs of these countries to help them tackle their cases. In DRC, for example, we've talked a lot about that, and we're very happy about what support has been given there. But countries should, other countries, such as high-risk countries, should also be supported in a continuous manner. And my country needs that kind of support. I get the impression that the risk in my country seems to be minimized. We have a hotspot here which is closer to Congo than Madagascar. So I have realized, as I said yesterday, that in our region we can have an epicenter. If there's an epidemic, you have Sudan next door and other countries next door, and you have peacekeeping missions, UN peacekeeping missions in that area. So it's a bridge to the world. It's a bridge to the outside world. So, Madam, regional risk is there, and it's very, very important for you to consider this situation with your team, so that you can have an approach in an adequate way together with countries. And coordination meetings of your teams, ministers should be invited to them. And we should have video conferences with ministers. And, we will look at all this risk and work together. Finally, and thirdly and finally, regarding transformation, as I have already said, Madam Regional Director, a country emerging from a crisis is an opportunity for transformation. It's a country that is looking, searching for itself, and my country is such an opportunity for transformation that you want, the kind of transformation we desire. And this is true for all similar countries, those emerging from crisis who are trying to reconstruct. It's an opportunity to reshape our health system. Thank you very much. We'll give the floor to Sao Tome and Principe.
Obrigado, Sr. Presidente.
Thank you, Mr. Chairman. Sao Tome and Principe would like to commend the Secretariat for the report presented and join previous speakers to congratulate Dr. Tedros for this transformation agenda implemented towards universal health coverage. We'd like to ask WHO to pay more attention to assistance to small island states, which are doubly isolated, somewhat like Sao Tome with several islands. The costs for delivering our programs is much higher than elsewhere, and Sao Tome and Principe, what's happening in Gabon, Cameroon, Angola, we see that we can feel the impact of what is happening in those countries. We need help. We're a small country, but we have the same needs as other countries, and we would also like to have assistance in terms of human resource development. Well, we have financial needs, but we also have human resource needs. We need people who can help us at the right time. Thank you. Thank you very much. We'll give the floor to the Gambia.
Thank you very much, Mr. Chairperson. Mr. Chairperson, the Gambia wish to take the opportunity to appreciate the work of the WHO and the efforts that have been put into this transformation agenda. Having read the document and looking at Gambia at the moment emerging from a very difficult circumstance and bringing in a democratically elected government, what I have seen in the report aligns itself with our national development plan. And it was very reassuring for the Gambia to see that the WHO is moving towards an agenda that is looking at the grassroots and also the participation of communities, which actually can effect change, like taking the Gambia as an example. We are currently working on transforming the healthcare system, having inherited very weak systems. And I am happy to say that the representative of the WHO has been very close to the ministry, working closely with us, looking at how they could engage to support what we are doing as an emerging democracy. And I would like to say that already there is a significantly important shift that we are taking, or going back to the primary healthcare system for which Gambia was well known in the First Republic. We are planned in our National Development Plan to go into it, and it aligns with what was commented yesterday with regards to emphasis on primary healthcare system. The Ministry of Health, with support from the partners, developed a roadmap 2018 to 2020 to revitalize this and scale up the primary healthcare system to reduce inequality and inequity gaps in it. I would like to thank the WHO Regional Director for supporting the health sector, and I would like to appreciate if WHO could support the implementation of the health in all policies approach in the Gambia. Another lesson that I have learned on this report is the fact that WHO is beginning to be self-critical and recognizing its role and trying to redefine its position in acknowledging some of the weaknesses and the setback it had with regards to resource mobilization and management. And I think that would be a best practice for emerging countries that are coming from difficult circumstances to follow, to start from the beginning. And I wish to associate myself with the report on behalf of my country and to say we look forward to a constructive engagement with the WHO and other related partners in moving the health sector in the Gambia and Africa beyond. Thank you.
Thank you very much. Following these comments, does the Secretary have anything to add?
Thank you
Secretariat.
very much, Mr. Chairman, honorable ministers. I'll first start by saying the transformation agenda is a living reality in many areas, and I'll draw your attention first of all to the fact that part of the reason why this agenda was conceived was a realization not only from you, the member states, but also from the different partners that work with WHO, that we needed to move away from business as usual. So the last 3 years has been an attempt to create an environment where we are moving with you as the Secretariat, addressing your priorities, but also looking at efficiencies in how we work with you. Yesterday, the Regional Director presented her report, and to avoid duplication in terms of presentation, some of the benefits or achievements that have come from the transformation agenda were clearly stipulated in that, and it's in more details in the reports that we've circulated of the regional directors, on the regional directors report. So I would refer Congo in part to that report, the detailed report, to look at some of the key, clear achievements that have been achieved. It was going to be a bulky report if we were going to do that. But we take on board your suggestions that probably in the subsequent reports we will be more clearer in terms of that, but we'll try and summarize that. But there is a report that the regional director presented. There are many areas that have been raised by the member states, and again, the transformation agenda is not a one-man show. There is a big team led by our different directors, and I'm sure as we answer some of your concerns, they will chip in to do that. Just to say, in relation to health coordination and leadership at country level, I think the WHO can do just that much, but we need the countries, your countries, to be able to take the leadership in coordinating the partners. The challenges that we face sometimes is WHO does want to coordinate, but without your support, your leadership to say, yes, WHO should coordinate, it is going to be difficult to bring people that are funded differently, that are addressing different aspects of health, to be coordinated. And that's why we'll call upon the member states to please help with the coordination. We are there to advise on how the coordination should be done in terms of health and health development. The functional review is ongoing, and as by the time we're coming here, we have 27 countries in which the reviews have been done, 11 in which we are in the process of giving feedback and for the implementation to start. But we must say that we are seeing interesting feedback from you and the partners working at country level. For instance, we've been made aware of the fact that the expectation of partners and yourselves as member states is that WHO should play a greater role in health governance, coordination, and health leadership. And this again has to be reflected in who we deploy or appoint to work for WHO at country level. And I think this is something that the regional director and the team are really paying special attention to. So rest assured that this area of work in terms of functional review and addressing where we think the country offices, our country offices should be, is really being taken care of. The alignment with the global transformation agenda, I think that again has been mentioned and highlighted in the RD's report yesterday, and we demonstrated that fortunately the big things that the global transformation program or plan is addressing are already being addressed to a large extent in the regional transformation agenda. Areas of universal health coverage and primary health care, health security, those are all within the regional transformation agenda as well as the global transformation agenda. We have gone a step further because of our uniqueness as a region to address issues of accountability, financial management and discipline. And I must add here that, and as mentioned by the regional director yesterday, we are beginning to see savings. And these savings are real, and I'm sure in the next regional committee we'll be able to give you a clear breakdown. But my colleague responsible for financial management may say something, but there is real saving in the way we are beginning to operate. Health systems in fragile countries, I think that's again something that we are addressing, and through the functional review again it's becoming clear that it is not just responding to the immediate emergency, but that we should also start building capacity within countries on how we are going to rebuild the health systems following major emergencies in our member states. The funding, there was a question on how much funding. I think I will leave that, and it will be addressed by other colleagues. Greater support to the SIDS countries. I think since the regional director took office, we've had 3 meetings with the SIDS countries. We are listening to you, and I think we're beginning to see the needs more clearly from the SIDS countries, and I would like to say that this work is continuing in the different clusters and programs. Congo, I will leave some of your comments to Dr. Moeti to respond. Health, the next area that we were seeing is human resource institutionalizing and training. I think that again is a welcome suggestion. We'll look at how we can work on with you, and I know we are working with a number of countries through our health systems colleagues. I will pause here and allow my colleagues and the regional director to comment on some of the issues that may have come up. Regional director.
Oui, merci, Monsieur le Président.
Thank you very much, Mr. Chair.
I'd like to thank you, really thank you sincerely for the breadth and depth and robustness of this exchange on the transformation agenda. This is exactly what we were looking for. We would like to assure ourselves that at the end of the day, what we have embarked on is changing the Secretariat, our ways of working, improving, is having an impact at the country level. This is what it is meant to do. So you are the stakeholders from whom we want to hear the most, how you are perceiving, how you are experiencing these changes that we are making in your Secretariat. And I'd really like to thank the ministers for the fact that we have completely overshot our time. I'm sure the chair is very aware of that. But I believe that it was well worth to get the width and breadth of feedback that we have received on the transformation agenda today. It's the first time that we've had such a wide-ranging discussion on this program. So I really would like to sincerely thank you for that. I think we will take on board many of the suggestions that you have made on how to make this work effective in terms of working for you, delivering for you. But I'd like to address specifically some of the comments that were made. I'm very interested in the Minister of Ghana's suggestion that we should actually have a ranking based on the report that we have written. We have in the report shown in green, amber, and red areas in which countries are progressing better or countries are not. Our experience of rankings in the past has been very interesting. And I mean, I welcome this suggestion, but I'd like to get the endorsement by the rest of the ministers. But from what I've seen in the past, a ranking agitates a very diverse response. Very often, the first reaction is to question the data, question the source of the data, and then we get engaged in a very long debate on that. Perhaps that is inevitable, and that challenges us to be sure that what we are saying is evidence-based. I would very much like to embark on this ranking, because I think it's a way in which we can compare similar countries. I recall when we were reporting on the Millennium Development Goals, that I used to say to my colleagues, we report on how can I say, the Comoros in the same way as we do on Nigeria. We don't take any account of the size of the countries or even of the socioeconomic status of the country. So perhaps what we can do in drilling down on some sort of comparator among countries is to try to group together what we consider as similar countries and see how they are performing in relation to their peers, for example. But we'd be very happy to do a ranking, and thank you for bringing out that suggestion. We certainly have the data that would enable us to do it, and we hope it would then engage all of us in a particular way, which in the 30 years that I've worked in public health, I've seen sometimes happens. You have asked us to detail out the delivery chain. Indeed, I think that's something that we can work on, so that we satisfy ourselves that we have defined a result. Our results are defined in the program budget that you approve at the World Health Assembly and that you discuss here. What has been one of my main interests is to make sure that once we've committed to a result, then we have admitted in WHO, and that is why Dr. Tedros is embarking on this reform of even the way that we plan, that our planning process and the way we have articulated the results in the past has been, let me say, challenged, so that we have in our reporting very much reflected processes in a grouped way. Because if you look at the WHO program budget, at the end of the day, we want to summarize at the global level what each of the budget centers has contributed, and the specificities by country and region have sometimes been lost. So we will look at working on ways of better presenting the link, as you've asked in the past, between the resources, the activities, and the results, and then the impact. I'd also like to address the comment that was made that we need to be sure that what we are achieving is linked to health outcomes in countries. We've developed, if you look at the WHO program budget right now, you find outputs that are really very much related to the role of WHO in providing support in developing norms and not health impact. In the key performance indicators for programs that we have adopted in the region, which we haven't presented here in detail, we have in fact linked our outputs, our outcomes to health impact and also to the Sustainable Development Goals. We are just starting to use these key performance indicators, and we expect that at the next report we'll be able to directly link what we have invested, what we have implemented, to a contribution to health outcomes in countries and to a contribution to the targets of the Sustainable Development Goals. So that's something that is in the pipeline as we have just started to use these key performance indicators. One of the reasons why I insisted that we develop these indicators is also to institute a culture within our organization of managing for results. I've asked my managers, the executive management team in the regional office and also the WRs, that in the day-to-day management of our work, we need to be sure that everything that we do, every activity that we approve by our staff is contributing to a particular output as measured by an indicator. And if it is not, then we will not do it. This is going to institute significant changes in the way that we work. For example, we organize regularly meetings with all sorts of people, technical groups, program managers, and sometimes we can question very hard what is the result of some of those activities. Is this meeting going to be productive in terms of change in that country in order to contribute to change in the health status of the population? So these are some of the questions that we are going to be more and more asking ourselves. I'm saying this in order to prepare your staff, your collaborators, your experts, and yourselves for the fact that we will change some of what we have habitually done if we understand that it's not as productive in contributing to our results, and we hope to have your understanding and your acceptance of these changes in the way that we are going to be working. The delegate from Tanzania made a couple of very important comments to which I'd like to respond. First of all, in relation to the functional reviews, the number that has been carried out in comparison to the number where we are proceeding, there has been approval. I have to confess as a regional director that some of this delay is my responsibility. And I'd like to, and I've already acknowledged to my staff that there is need to accelerate the review and analysis at the level of my office and myself and approve some of these recommendations that have been made. One of the drivers of this has been very much the financial implications of the recommendations that have come out of these functional reviews. And I'm very glad and very relieved that now, at the global level, the decision has been made under the leadership of Dr. Tedros that there will be this shift of resources towards countries, which is defined as technical work in countries, but which will also, I hope, cover some of the increase implied in staffing costs of WHO country offices by the functional reviews. They resulted in increases of staffing budgets starting at 30% and in some cases going up to 200%. And part of my concern in approving has been to check and confirm, if you like, the feasibility of being able to mobilize these resources at the level of the country office and the regional office in order to be able to put in place then the changing of staffing that are recommended. But this is something that we're working on, and I'd also like to share with you, since I'm talking about the functional reviews, some of the experiences that we've had in making these changes, which have implications for your own engagement as we embark on making these changes. First, as I said, we have implied increases in staffing because we recognize that even though in the past the WHO country offices have tried to have an expert for every program, we've understood and you've recommended some shifts in the way we staff our offices, which have very much emphasized our support to your capacity to coordinate your partners, to support your work in leadership of the sector, to provide support in making sure that you have robust data systems, as I mentioned yesterday, which will guide your action, and to support your resource mobilization and coordination of partnership. In the average country office of WHO, that really does imply having additional staff or having staff of a different profile. And the question that I've asked the team that is working on the functional reviews is that, okay, what does that imply then as far as support for some of the programs is concerned, because we have to accept with our member states that we're working within limited resource envelope. If we increase certain types of competencies, it implies making shifts and reducing in some areas. I did ask the question that, for example, in the area of child health, we have several other agencies working on child health. So would it be acceptable to reduce our capacity as far as the staffing in child health was concerned? And some of the responses I got was no, 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 no. So we are needing to juggle priorities and try to see how we can realistically mobilize the resources to make these shifts in the staffing of WHO country offices. But that's something on which we'd like to continue to engage with you. Another implied change has been to recognize that some of the functions are at a level where we would like to increase the number of international staff, with implications for perhaps reducing the number of national staff, national program officers that we have. We've had some extremes of responses. I have one country team, national officers, threatening to take me to the ILO. Because, yes, I think it's important for ministers to be aware of some of the reactions that we're receiving. Because implicit in the shift in the types of competencies is the fact that when we look at the stuff that we already have in place, some will be needed going into the future, some will no longer be needed. There are areas that we are going to be de-emphasizing based on the outcome of the analysis of the functional review, and there are others that are going to be brought on board. So just to let you know that we have a range of experiences, including some digging in of heels by national program officers in some countries who are demanding to continue to be kept in their jobs. So I hope very much that as we go ahead and implement these changes, which will inevitably involve some people losing their jobs, we will have your understanding and support, because these recommendations are based on a very intense dialogue with you and with the partners that work with you at the country level. I'm managing my threatened ILO case as well as some others. And I think it's natural for staff members when they lose their jobs to appeal. So we have in some country offices some appeals by individuals, just to make sure that we are being fair as we make these changes. I'm dwelling on this a little bit because I do think that our being able to have country office teams that are fit for purpose to work with you is one of the most important changes that we're going to be making as far as the transformation agenda is concerned. And I'd like us to be moving along in this direction together, adjusting as we make the changes, and in a way managing some of the fallout of instituting change, which may sometimes involve individual staff members. What is the marginal value of the reforms? I think we can provide some data on this. We did not include it in the report. Certainly, we've tried to achieve some efficiencies in the way that we work, and in the area of procurement and contracting, we're already seeing some savings in a limited number of countries where we've actually done the analysis. We will circulate information on this following the questions that were posed to you in writing, so that we can supplement the report that we provided you. I'd like now to address the issue that was brought up. We've had very interesting discussions around the issue of leadership, the issue that were brought up by the Honorable Minister from Burkina Faso, to say that indeed this is one of the areas in which we'd like to demonstrate the change. But this, I would like to suggest, is going to be joint work with you, the Ministers of Health. If we look back at what has happened to have this rotating leadership around countries, my experience is that it arose out of two things. One was when we had in some countries a pooling of resources, a contribution to budget support, and therefore the donors, the member states who were donors, insisting that since they were contributing their money in a certain way in a pooled mechanism, WHO and the UN agencies were not. WHO is not a funding agency. So what we do is come with our technical advice, and in quite a number of countries, in my observation, there has been an insistence that we have a pooled partners mechanism, and that we have therefore a rotation of donors, agencies who are putting their money together into a common pot to support the health sector. That's been the case in some countries that were instituting health reform. And it, in a way, leads to a partial response to the Zimbabwean minister's concern. Sometimes the power in leadership is manifested by those who are contributing the most financially. That's why I'm saying this is something that we need to look at together with yourselves and your officials. Because an agency that is bringing technical advice is sometimes seen as part of the house. You are part of us, you are our Secretariat, and it is some of the others who have the weight of the financial resources that they bring and put on the table, who then are accorded this role of leading. Having said that, we take on board the comment that you are making, and we would like to work with you. What I've seen is that in countries where the government insists that while we have the strength of financial contribution of some partners, while we have the potential for rotation, WHO should, through its normative role, through the role of working in health more broadly than most partners, including our sister UN agencies, play that role of the particular partner who is sitting next to the government and helping you in your role of leadership, coordination, and stewardship of the health sector. So this is something that we'll examine more, and I thank you very much, Honorable Minister, for having made that comment, because it will help us to work further on this. In my view, it demands a very close collaboration with the government, the ministry, in order to be able to enable WHO to play that role. What we are doing as part of the transformation agenda is to make sure that we improve the leadership skills of the people that we send to work with you as WHO representatives, so that we go beyond technical expertise. We have, as WHO representatives, people who are leaders, who are coordinators, who are able also to work with partners in such a way as to facilitate a respectful, mutually respectful partnership while playing this leadership role. We've invested in this, and we are shortly going to be embarking on a training of our WHO representatives in countries to improve the type of competencies that they have, because quite frankly, we appoint our leaders from our pool of technical experts, and we recognize that some of the skills that are needed to play a more effective leadership role need to be built up in the staff that we have as leaders. The Minister from CIR referred to how we support countries in developing their human resources. Over the past decade, we have progressively reduced our contribution to scholarships in countries, because we had understood, and this happened before I became the regional director, but our understanding, and I'll own it as a member of the Secretariat, was that many countries now had other sources of funding for this training. I think what you are saying is that we need to look at country specificities and see those who have been able to build up a cadre and perhaps rethink for countries in a special situation. And what I've seen is in some of the smaller countries, perhaps countries that have been in crisis over some years, this capacity to build the skills and train your own people without a WHO scholarship perhaps might be more relevant than we had thought in the past. Having said that, we have heard many requests for help to train specialists. At the same time, we've recognized that there are huge gaps in the healthcare workers who are needed to provide basic healthcare. Nurses, if we look at the WHO recommended standards, we don't have enough nurses anywhere in the region virtually. We don't have enough general doctors anywhere. We absolutely don't have enough public health experts in most of our countries. We are receiving many requests to train specialists, clinical specialists. So we are needing to try and, perhaps country by country, analyze these needs and see where the emphasis should be in helping to build the human resources. But I recognize that problem. I'd just like to make a response to the Honorable Minister for the Congo and say that, yes, indeed, we need to speed up what we are doing so that the results become evident at country level. But also to restate, as I've done before, that one of the changes that I have made as regional director since I come in is to say to my colleagues that we need to have the impact of having our headquarters in the Congo felt by having a direct relationship of providing support to the ministry and the government in this country. I think, Madam Minister, you have probably received more support from WHO and particularly from the regional office than practically any country, but we can provide some of the evidence to this in terms of the missions that we have carried out to support your change agenda in the country, particularly the work that we've done with you and your team around finalizing the national plan for health and working on the assessment of some of the institutions that you have in place. We are indeed working, we've done the functional review of the Congo, and we are now going to be looking for the resources to increase the capacity of our country office, but I'd like to assure you that we're going to continue through the Commission Mixed, this mechanism that has been put in place to provide support from the regional office as we have done, and to work with the government of the Congo to make sure that we have a mutually supportive relationship that enables our regional office to function and to perform optimally in this context of the Congo. But this is something that we are going to continue to work on. But certainly, let me assure you that you've received more support from the regional office than any other country in the region. Literally, we will increase our support, we will respond to the needs, and we very much look forward to the finalization of the National Health Plan, because it's on the basis of this that we'll be able to rationally provide the support that your country needs. I think I will end there just by assuring ministers that we are looking for innovation as well as for covering some of the gaps that were identified in our performance as a Secretariat. So we welcome very much your suggestions. If there are radically different ways of doing business, please be assured that we are open to ways of changing what we do. Again, as I said, at the end of the day, we would like to be assured that what we are doing is making a difference in terms of our delivery in supporting you. And I'll finish by very much appreciating the encouragement and the positive comments that were made by some of the ministers in the changes that we're making in the region. Thank you very much.
Je vous remercie, Madame la...
Thank you very much, Madam Regional Director, ladies and gentlemen, delegates. After these comments and explanations, I think we can consider that the Regional Committee is taking note of the report and all the perspectives contained in our document AFR/RSC 68/4 on the implementation of the transformation agenda. The committee does not take note of the document. Thank you. I think should allow ourselves to have a break of 15-20 minutes and then come back into the room. Thank you.